FORA.tv. The world is thinking.
When I was writing this book, I thought to myself, I know a lot about healthcare policy. I mean, I just not only immodest about it, but I do. I'm certainly not the biggest expert in the world, but I know a lot about it. And there's a lot of things in these bills that are coming through that I don't like. And I vowed that I was not going to say one bad thing about them, except for mild disagreement if asked, except on the subject of the three things that have to happen: guaranteed issue and community rating in the private sector and a public option. And the reason I'm not is I don't have a vote. I'm not there. I don't have to make the compromises. And I don't want to get distracted, even by tax policy. If they screw up the tax policy and they put in some tax that we don't like, they can fix it in a year. But you can't fix the opportunity to give Americans the choice. And once you put that in their hands, they're not going to let you take it back, which is, of course, why there's a lot of resistance to it. The one or two places I did stray is in how you finance this. There's a lot of talk about financing. And I'm not going to run down to Congress and make a big deal about this, because I think that they should be able to do whatever they have to do in order to get this passed, as long as there's a public option. But I think we ought to finance it with a carbon tax. I think we ought to get rid of all the millionaires' taxes and the taxes on the people who have fancy policies or whatever else. Just use a carbon tax. Why? The first time I've ever proposed this, I always resisted increasing the gas tax when I was governor, because it disproportionately hurts working poor people. In rural states, working poor people have to drive 50 miles each way to work because they can't afford houses where the jobs are. This happens in California, and it really happens in places like Vermont and Texas and so forth and so on. But the carbon tax is the perfect tax. First of all, we have a ridiculously low gas tax. Even in California, you pay half or a quarter of what people pay elsewhere. It does change people's habits. It makes the planet much, much healthier. And the people who are going to pay the most tax proportionately are the people who are by far least likely to have health insurance. And if you did a poll of the poor, working poor, and the modest, who aren't poor but really struggling and have to drive all those miles, if you said, would you pay another $100 or $200 a year in gas taxes if you could have health insurance that could never be taken away, would always be affordable, would never be, you'd never be subjected to pre-existing conditions? I think the answer would be 90% yes. So why not use a tax that heals the earth and gives people incentives to do nice things for the earth while you're healing the healthcare system?